Okay, so I just wanted to show you where we're at here. We are going to repair the posterior horn because that's really important, and I don't want to take away any more meniscus than I have to. Our hands were kind of tied here with this part that was torn and flipped under. We'll go ahead and keep working here. Okay, so here's our meniscus problem there. That little turned under bit I don't think is repairable. But we also know that there's a tear in the back here. So let me get the shaver first. Actually, biter. Gabriel. Okay, hi Gabriel. It's Dr. Buford. We're just getting started on the left knee. We're looking in the medial compartment here. And we're just right now irrigating the knee out a little bit. I see the meniscus tear. We'll get to work on that in a minute. Meniscus tear is back there in the posterior horn. This is the notch, and we can see the ACL looks good. So as we drop the knee down, the anterior cruciate ligament looks good, and the knee was stable. Your knee was stable once we had you under anesthesia. We'll turn the brightness up in just a minute. It'll make our picture a little bit better. And go up to 100% on that thing. And then as we look here in the lateral compartment, we're not expecting to find any problems here, and I just want to confirm it bend the knee. And that looks pretty good here. So we can see the posterior horn of the lateral compartment. The articular surfaces look great. No signs of any significant problems there. We're just flushing out the area. So that looks good. We'll show you some more in a little bit. Okay, so here's the patellofemoral compartment. This actually looks pretty good. The patella at the top looks great. Trochlea here looks good. So I think we're just looking at this isolated medial meniscus tear. That's the medial gutter. We sneak over here and look down the area that we call the lateral gutter, way down here. And all of that anatomy actually checks out pretty good. So we're going to get back to work on the medial side in just a minute. Okay, we're going to start where it's hardest to see. Hold the camera there for me, just like that. Let me see if I can get my best picture. Yeah. Okay. Huh? I know. No, you're fine. Let me do that. Okay. Okay. Let's see. Yeah. I think that's back, huh? Okay, so here's our Superball device coming in. We're going to start with our most superior suture. Back here. Hold the camera there. Okay, so I think that's buried. Okay, and then we'll back out. Okay, that looks good. Pause. All right, so that looks good. We're going to go ahead and put in the shaver one last time. Hold that, please. Just to make sure there's no more loose pieces. There we go. There's our finished repair. We did kind of a crossed stitching pattern. There's a pretty good look at that. It's stable. I'm just turning suction on the shaver to make sure everything's stable. And that feels very stable. Okay, so I think we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.